Respected Sir, I rise to move that the National Commission for Allied and Healthcare Professions Bill 2021 as passed by Rajya Sabha be taken into consideration. Sir, before the House and the Honourable Members give their worthy comments about the bill, I would like to in another 10 minutes or so briefly introduce the subject to the Honourable Members. Honourable Members, some of you, or I would say most of you, must have had a visit to some hospital at some point of time in your life. And I wish not, but you might have had to. I'm sure about it. Please recall those days and remember the people who took care of you, who brought you out of your illness. You may remember the name of the doctor, you may remember the name of the hospital, but do you also remember the name of the person or the person who would take your blood sample, give you physiotherapy, take your X-ray, advise on what you should eat, check your eyesight, assist your doctor or surgeon, look into microscopes, and bid you farewell with a smile? Who are these people? Yes, I am talking of varied professionals of lab, technicians, physiotherapists, radiographers, dietitians, record keepers, optometrists, X-ray technicians, and many such professions who are as much, if not more, a critical part of the healthcare system as the doctor himself. After bringing in the historic reform of National Medical Commission in 2019, of which you were all very active contributors, to reform and streamline the sector of medical education, we now have another bigger opportunity to transform the much bigger sector of allied and healthcare professions, a group comprising of more than 56 different professions that have been till date unrecognized or unregulated. It gives me great pleasure to present a historical milestone bill that is being taken up in this august House today, 74 years after independence. Friends, the bill I am presenting today has the potential to create a paradigm shift in healthcare delivery of the future by recognizing the specialized skills and contributions of more than 56 types of healthcare workers, that is the allied and healthcare professionals. A major paradigm shift is being effected in healthcare service delivery, embracing a multidisciplinary care model. We all are witness to the developments around COVID-19 in this country in the last 1 year. COVID-19 has highlighted the invaluable contributions and sacrifices of these professionals in the front line, risking their lives every day selflessly fighting the pandemic. The invaluable role of respiratory therapists, laboratory technologists, psychologists and physician associates, among several others during these past 15 months cannot be overstated. The crores of blood tests and RT-PCR tests during COVID were possible only due to the skills of phlebotomists. Phlebotomist is one who takes our blood sample, and the lab technologists. The need for development and maintenance of standards of services and education of such professionals through a national regulatory body has thus been long overdue. As these group of professionals are loosely referred to as paramedics, however, the fact is that paramedic is only one type of allied healthcare professional trained to handle emergencies in an ambulance setting. The group of allied and healthcare professionals is much larger, and we are bringing in a law to reform and regulate this entire sector in order to give them their due through increased employment opportunities, both in India as well as abroad, but more importantly, dignity in recognizing their true worth. Further, the potential of these professionals can be utilized to reduce the cost of care and to make quality healthcare services accessible to all. Colleagues, India is not only being looked up to as the vaccine manufacturing and pharmacy of the world, but also for our competent and compassionate health workers, doctors, nurses, and allied and healthcare professionals. By 2030, the World Health Organization has predicted a shortage of 1.8 crore healthcare workers in the world, of which almost half will likely be in the allied and healthcare professional space. Our 80 lakh plus strong healthcare workers today include a large number of allied and healthcare professionals who have the ability not only to contribute in a much bigger way at home, but also as part of the global health workforce. Before I come to the salient features of the bill, I wish to recall the long journey of this reform. During the decade of independence, several statutory bodies were established for what was understood then to be important professionals in healthcare: doctors, dentists, nurses, pharmacists, and decades later, rehabilitation-related professionals. Several committees, starting from Bhore Committee in 1948, followed by Mudaliar Committee in 1961, Chadda Committee in 1963, Srivastav Committee in 1975, Medical Education and Review Committee led by Mehta in 1983, Mukherjee Committee in 1995, Planning Commission Task Force on Planning for Human Resources Health in 2007, among others, have stressed on the importance of quality human resources for health. The Bajaj Committee specifically indicated the need for organized, allied and healthcare professionals with the right skills and training to truly make a dent in the health system and provide the citizens with their constitutional right to accessible, affordable and quality healthcare services. The first of such efforts to establish a regulatory body in India started over 2 decades ago when a bill for physiotherapists and occupational therapists was drafted in the early 1990s. After a series of consultations, reviews and amendments, in 2007, the Paramedical and Physiotherapy Central Council's Bill 2007 was introduced in the Lok Sabha and was referred to the Parliamentary Standing Committee for examination. The 2007 bill proposed standalone councils for 3 professional groups, namely physiotherapy, laboratory technology and radiology and imaging technology. In their 31st report on the said bill, the Standing Committee indicated the need for an overarching council structure encompassing more such professions which remain unregulated. Since the Paramedical and Physiotherapy Central Council's Bill 2007 lapsed with the dissolution of the 14th Lok Sabha in the year 2009, another proposal for the consultation of Paramedical Council was included in the National Commission for Human Resources for Health Bill in 2011, introduced in Rajya Sabha in December 2011. However, there was opposition to this bill from the existing regulatory bodies. Therefore, we moved away from a unitary structure for all health professionals, both regulated and unregulated, and the present bill is thus confined to regulating cadres not already covered by other regulatory bodies. I will also like to recall that former Health Minister of India, Shri Ghulam Nabi Azad ji, released a landmark report, From Paramedics to Allied Health, Landscaping the Journey and Way Forward, in 2012. In this regard, we have strived to accelerate this reform by developing the framework and structure around the recommendations provided by the experts during that phase. The bill was modified to incorporate all the allied and healthcare professions in 2015. This, after revisions, was approved by the government in November 2018, and the Allied and Healthcare Professions Bill 2018 was introduced in the Rajya Sabha on 31st December 2018. The same was referred to the Department-related Parliamentary Standing Committee for Health and Family Welfare on 4th January 2019. Based on the recommendations made by the 117th Department-related Parliamentary Standing Committee report, dated 31st January 2020, on the lines of the National Medical Commission, necessary changes were carried out and a fresh bill titled the National Commission for Allied and Healthcare Professions Bill 2020 was introduced in the Rajya Sabha on 15th September 2020 by withdrawing the pending bill of 2018 and has been passed by the Rajya Sabha. I will now come to the key features of the bill. This bill, once enacted, aims to establish a central statutory body as National Commission for Allied and Healthcare Professions. The Commission will frame policies and standards, regulate professional conduct, and prescribe qualifications for all these professions. The Commission will be supported by 10 broad professional councils, each comprising one or more professions. The institutional structure proposed in the bill enables assessment and rating of all the allied and healthcare institutions to ensure uniform standards and quality assurance. This also provides for registration of all the allied and healthcare professionals, facilitating their career growth and improving their employment potential both within and outside India. All the professions have been coded as per the International Labour Organization's International Standard for Classification of Occupation, which also allow them for global recognition and mobility. A National Allied and Healthcare Advisory Council to advise the National Commission with representation from all the states has also been proposed to enable adequate representation from all states and union territories. Further, each state will be having a separate state council with 4 autonomous boards pertaining to undergraduate education, postgraduate education, assessment and rating, and ethics and registration. Since allied and healthcare professions include a wide variety of different professions, numbering more than 56, a common regulatory body has been prepared for all these professions. We have carefully considered the invaluable inputs of the Parliamentary Standing Committee members and incorporated almost all of those in this bill. The year 2021 has been designated as the International Year of Health and Care Workers by the World Health Organization. I feel happy and delighted that in this very year, we are considering a landmark legislation that will reform and open up huge opportunities for our allied and healthcare professionals. As a doctor myself, I am personally elated that the National Commission for Allied and Healthcare Professionals Bill will enable a team-based approach to care where the patient's well-being is the fulcrum around which several professionals operate. Through task shifting, specific tasks will now be moved to specialized allied and healthcare professionals for better reorganization of health workforce and improved health care. I therefore request all of you, call upon all of you to support this bill in solidarity and conclude its journey of more than 25 years now, fulfilling the long-standing promise since independence and ensuring the greatest good and healthy future of this nation. Thank you.